Hi, my name is Lindsay Keating, and in this video today, I'll be performing my CVAD video checkoff. So I have already donned my PPE and entered the patient's room, performed my hand hygiene, introduced myself to the patient, and explained the procedure. And I've also created privacy for my patient. So today, I didn't have anyone to video for me, so I'm doing it on my computer, and I'm going to angle it down so you can see what I'm doing, but my head will be cut off. So I'm going to go ahead and angle it down. Okay, that looks good. Okay, so the first thing I'm going to do is I'm going to open my kit using aseptic technique, maintaining my 1-inch border. So I see here that I have a mask, and normally I would place this onto my patient, but today I'm just going to set it off to the side. So now that I have opened my kit using aseptic technique, I'm going to don my sterile gloves. So now that I have donned my sterile gloves, I'm going to come over to my sterile kit and I'm going to arrange my contents of my kit, making sure I don't go past the 1-inch border. So the first thing I'm going to use today is my alcohol swab stick, and I'm going to open it. And now I'm going to take my alcohol swab stick and come over to my insertion site and clean from the insertion site out, making sure that I do not cross over the same cleaning site twice. So the next thing I'm going to do is I'm going to take my ChloroPrep and I'm going to activate it. And I'm going to come over to my CVAD. And I'm going to take my non-dominant hand, and it's going to become unsterile and contaminated now to stabilize my CVAD. And I'm going to take my ChloroPrep, and I'm going to vigorously clean the site for 30 seconds, back and forth, vertically, horizontally, and using circular motions. So now that I have done that, I'm going to take my bio patch, and according to hospital policy, I'm going to have the blue side up, and I'm going to take my non-dominant and unsterile hand now and stabilize it and place my bio patch. So now that I have placed my bio patch, I'm going to take my Tegaderm, and I'm going to use my non-sterile contaminated hand, but I'm not going to touch anything that is sterile on the Tegaderm. Now I'm going to take my Tegaderm and I'm going to open it up. And I'm going to place it over the wound site. I'm going to make sure that it is tight and secured on there with no creasing. Now I'm going to undo it. And now that I've placed it on there, I'm going to make sure that it is on there tight with no creasing. And it is on there tight. So now I'm going to describe my documentation points. I would document the site of appearance, the the type, amount, color, consistency, and odor of my drainage, the characteristics of my drainage, and if there's any cultures obtained. I would also note the type of cleanser used and the type of dressing I applied, and also how the patient tolerated the procedure. I would also put my date, time, and my signature. And that completes my CVAD checkoff video.